Okay, hi everyone. Happy Friday. We made it through yet another week, and if you have Top Hat open, you can close it right now. Today is going to be kind of like a catch-up day, so we're just going to try to blow through as much of the appendicular skeleton as we can today. So that's pretty much what we have on the agenda. So let's finish off. We didn't quite get through the upper limb last time, so yeah. Math exam got you drained. Oh, well, at least it's the weekend so you can recover. All right, so we talked about our pectoral or shoulder girdle, so we talked about the scapula and the clavicle. Now what inserts in that glenoid fossa or cavity? Again, glenoid something. I just want you to know both. All right, so what we have there, remember that glenoid fossa or glenoid cavity is very smooth. So the smooth head of your upper arm bone. So when they say the arm bone, they mean the upper arm bone, they're referring to the humerus. And again, especially, well, if you're taking the lab, you're already taking your first exam, but spelling does count. So it's not like humerus as in haha, humerus, it's humerus like how it's spelled here. Now, what we have here is that smooth head, and what you notice is that the head also, when long bones, they have this head, and then they also have this long area called the shaft. Now, over here, we have the anatomical neck. So in other organisms and other animals, this neck might be more slender and elongated, but it's actually what it is like a very short stubby neck, and kind of like this guy right here. And again, actually he has a cervical, it's like, remember how I said the cervical vertebrae should be separate? This guy has a congenital genetic condition that causes it to be fused. And yeah, I'm making fun of him because I saw I was disrespecting that poor girl from the Philippines. But I don't know, I can't help it. But he's kind of like, when you see someone like that, you can't help but like, okay, kind of struggle. Yeah, so. But the thing is that there's a different neck. So this is what you call the surgical neck. And when you think surgery, you think of getting in the OR, right? So even though this is, through evolution and other organisms, this might be the neck of it. So the head's connected to the shaft. The surgical neck is what actually breaks more often than the anatomical neck because, again, you have that very, very thick neck. So, again, it's less likely to break in the anatomical neck than this relatively slender surgical neck. Yep. And then what we have here is this greater tubercle. And remember, a tubercle is kind of that small rough bump. And then there's lesser tubercle over here. So in between that, we have what we call the intertubercular groove. So you do have these two bumps. It's kind of hard to see in this picture, but there is a slight groove between these two. And remember, like tubercles, tuberosities, trochanters, they're rough projections because something is attaching to it, whether it be a tendon, ligament, or other tissue. Okay, let's zoom in on the distal part. So now we're looking at this part of the bone over here. So this would be where your shoulder girdle is. Now we're traveling down the arm to your elbow joint. And we're looking at the right humerus. So we're looking at your right one and we're looking from the anterior. So this would be toward the medial, so this would be toward this side here, and lateral would be toward this side. So again, long bones don't look like the cartoon doggy bones or the chew toy bones or milk bones you give your doggy. They have a different side too, like the lateral side and medial side are often slightly different. And this is what we see here. So we have these condyles on the distal part of the humerus. And remember, condyles is kind of like a knuckle, smooth kind of projection. So there are particular names for the condyles on the humerus. And here toward the lateral side, so this would be toward this side, would be the capitulum. And then you have the trochlea forming this condyle. So notice the trochlea has a little more prominent ridge here, and this capitulum is pretty smooth and round shaped. So what you also have are these things called epicondyles. So epi, remember, like epidermis means above the dermis. Well, with these epicondyles, they're above or outer to the condyles. So here we have the lateral epicondyle, and again, this is why you need to know your directions, like lateral, medial, proximal, distal, especially when it comes down to your bones. And then we have our medial epicondyle on the opposite side. Okay, and now we're looking at the anterior view. So what do we see is that we have our forearm bones. So there's two bones in your forearm, and they are the radius and the ulna. So notice that the radius and ulna, the part that articulates with the humerus, they're also differently shaped, and this makes sense. So if there are different shapes here, you have different types of condyles and different shapes that fit the radius and the ulna over here. So this is the head of the radius that fits with the capitulum, and here's the coronoid process of the ulna. So it's kind of interesting. The head of the ulna is on the other side for some reason. So they call this the coronoid process. So the way I remember which one goes with which, like, does the radius go with the trochlea or does it go with the capitulum? Does the ulna go with the trochlea or does it go with the capitulum? So I'll go over the ulna real quick. So what we have here is the back of the elbow joint. So you can actually feel this. If you feel the point of your elbow, you can feel this bony part. So what is this? Well, remember our landmarks, and that if you have ashy elbows, you might rub some Olay cream on it. So the olecranon is the point of your elbow, the posterior point. And this is where it fits in. So remember that sometimes fossae are sunken, smooth surfaces, and they often fit something in it. And in this case, what it is fitting this part of this bony part called the olecranon. It helps to, this is how you're able to move your elbow joint, and it has a space so that you're able to fully extend and move your elbow joint as well. Okay, so this is the radius and ulna. So what we have here are I'm just not pointing out all of the landmarks, but I think this is a pretty fair list to go over. This is also in the slides as well. But what we see here is that the radial head is more proximal, the ulnar head is for some reason distal. And why is it like topsy-turvy that way? Well, I just think of it, okay, the olecranon is the point of your elbow. The head has to be somewhere, so it's going to be on the other side of the ulna. And the other thing is, like, how do you keep these two bones from separating? Well, the joint plays a role in it, but you also have what we call the interosseous membrane. So you have this dense connective tissue right here, and it's able to connect this. It has a lot of collagen to hold and keep these two bones together through all your muscle and joint movements as well. And this is looking from the anterior view. So again, they're not just moving independently. You have this membrane helping to hold that, and also the muscles that surround the bones as well. All right, so the ulna and radius. So the radius is more toward the lateral side, and then the ulna is toward the medial side. We're looking at the posterior view over here. Why is anatomical position like this? When we're just standing, we're kind of like this, like just putting our hands to the side. Well, the thing is that when you're in this kind of position without putting your hands forward, but in being in anatomical position, you uncross the ulna and radius. But if you just have your hands relaxed and forearms relaxed at the side, it becomes harder to see these bones because they're slightly crossed and slightly overlaid with each other. At least that's the example. When I was learning anatomy, that was the reason given to me. Okay, so the medial is the ulna, the radius is lateral. Okay, so let's look at that ulna as well. So what classic thing, like, how do you identify bones? Like, if say you go, if you're like doing an archaeological dig, and how do these archaeologists, or in more recent times, like maybe if you're into forensic science and you encounter a crime scene, you might have to identify bones. So ulna, this is again the olecranon we can see here. This is the proximal part that forms part of your elbow joint. And here we have that radial notch. Again, we have, whenever there's some sort of like recess or groove, that makes room for something. So the radius is actually snug against this part of the ulna. And then we have the trochlear notch, and again, this is going to fit with the trochlea of the humerus. Yeah. So this is what we have here. So did I get that mixed up? Like radius is lateral, ulna is medial. Yeah. Okay, so this is an easy way of determining what the ulna is. So when I look at this, the trochlear notch, I like to think of it this way. That trochlear notch is a dead giveaway that the ulna that's the ulna. So I like to think of that trochlear notch is kind of shaped like a U. So U stands for ulna, and the radius doesn't have that. Now, what does the radius look like? So again, the radius is lateral. I don't know if I'm getting that mixed up. I have to go over it's been a long day. I'll have to go over the footage, but radius is toward the sides. It's lateral. Okay, so then what we have here is the radial is with this is the radial head, and it's kind of hard to see from this picture. So this is the part that articulates not only with the humerus, capitulum of the humerus, but also fits in that radial notch of the ulna. If you took this and kind of turned it this way toward you and looked at straight at the head, it would look like this. I had to get this from like ortho, so it's kind of bloody. It's actually somebody's head of the radius, but I like to show it because it looks very round, right? So if you remember all the way down back to high school geometry, remember what's a radius? It's that line going from the center to the perimeter of a circle. So I like to think of it that way. It's like a radius, like as in a circle. So that's the way we remember it's like the radial head. And this is also a clue to its function. So this is one of the classic things where form dictates function, because the radial head actually rotates. And when you move your arm like this, when you go from supinated to pronated and back, the radial head is round, and that movement of it and pivot is part of the reason why you're able to actually rotate and cross and uncross your forearm bones. Okay, and now back to our elbow joint. So we have our radial capitulum, trochlea, and this is my mnemonic. So this was like Captain America, and then and again, it's like if you are watched the whole series, you know that's changed. But what is he doing? What shape is his shield? His shield is round, right? So I like to think it's round like the radius. So Captain carries a round shield. He carries the radius. That's the way I remember that the capitulum of the humerus articulates with the radius, the round radius head. Now, by a process of elimination, we know that the trochlea articulates with the other ones, so it articulates with the ulna, the ulnar coronoid process. Radius is aligned with the pollex. Yeah, I mean, I think most of you wouldn't get it, but ask your maybe mom, dad, or if they were like young parents, your grandma or grandpa, like something that worked for like maybe the elder millennials or Gen X is like, back in the 80s, they used to go radical and do this. So the thing is like radical is like radius, and this would be on the same side as your pollex. Yeah. Capitulum. I haven't seen that one, so I have to look at that. Like, I mean, that might be a Latin one, so I have to check. But I've always seen it spelled like kind of this, like capitulum. But either way, capitulum articulates with the radius. Okay, so this is like you go more distal from the radius and ulna, and now you have your hand and your wrist. So your wrist bones are collectively called the carpals, and then you have all these bones that make up your hand and your palm of your hand. And so again, this is looking proximal and distal. And in terms of your fingers and the bones in your fingers, and this is great, you can actually feel the bones in your fingers, right? Unless you have very thick fingers, you probably can feel the bones. And what you can notice is that you have all these phalanges, and this is how they are named. So they are named after proximal and distal. Again, if you're not familiar with those terms, get familiar with them really quickly, because this is how your finger bones are named. So the proximal phalanges are the ones you can feel, like that are closest to your palm, and then the distal would be the most distant, right? And right in the middle is that your middle phalanges. So that's what you have there. But you notice that, okay, each finger, so you have 1, 2, 3 bones. So you have proximal, middle, and distal, right? But what about your thumb? So your pollex only has 2 of these bones, right? So all it has is a proximal and a distal. So you have proximal phalanx and your distal phalanx. And there's no middle, because again, unless you have like a very rare anatomy and you have somehow 3 bones in your thumb, there's only 2. All right, so then you have the pollex, you have your phalanges, and then you have your carpals. So in the between, you have the metacarpals. So remember, like meta often means in the middle. So between your wrist bones and between your fingers, you have your metacarpals. So your metacarpals, you can actually feel, especially on the dorsum and back of your hand, you can feel these bones over here. So they help make up some of your palm. Now, again, you can move them, but they're not going to separate from each other very widely, because again, they're contained within the palm of your hand. Your friend has 3 bones in the thumb on his right side. That's so cool. I was like, I have to see that. Like, if you send a picture, that would be really cool to see. But yeah, I mean, some people have rare anatomies, or some people have an extra phalanx, and it's like, wow. Actually, I wonder if they have like 2 or 3 if they have extra phalanx. But let's not get too carried away. Okay, so my mnemonic for that is like metacarpals. If you like your root words, meta means in the middle. But another way I think of it is like, okay, they're not phalanges because they're meaty. They're actually your meaty carpals because they're contained within the meaty palm of your hand. So that's the way to remember that the metacarpals are there. So again, they're not the ones that you can move around like your phalanges. They're the ones contained within the palm of your hand. Now what we have here is that how do you count in anatomy? So if you ask someone to count their fingers, they go 1, 2, 3, 4, 5. But in anatomy, you start with your pollex, and then you go to your little finger, or your pinky, right? So it's going to go 1, 2, 3, 4, 5. So that's the way you number your metacarpals. It's also how you number your phalanges as well. Now, let's zoom in here, and this is where it gets a little more, probably one of the more tougher parts when studying a skeletal anatomy, is you're like, oh wow, like if you've seen pictures of carpal bones, you're gonna be like, oh, these all look like a bunch of like pebbles or rocks. And these little bones so there's 8 of them total. They have different shapes and they all have unique names. Now what we're looking here is the anterior view of your right hand. So you would be looking at your bones like this way. But the thing is that, or actually it would be, yeah, if you're looking, yeah, kind of like this way. So this is what we're seeing here. And what we have here is the scaphoid, and this is going to be proximal and closer to your forearm. So scaphoid, lunate, pisiform, triquetrum, your trapezium, your trapezoid, and this is what gets me, like, it's like trapezium and trapezoid. It's like, if you think things are confusing, somehow they think, okay, trapezoid is like a trapezoid in geometry, and they think trapezium kind of looks like a trapezoid, but let's make it more Latin sounding. So there's like 3 of them that sound very similar. So my mnemonic for that is like, okay, so if you're from here, you might be familiar with pigeons. So it's like, try quit before you piss me off. So this is the way I remember that the triquetrum articulates and connects is right next to the pisiform. I mean, I know like some of the anatomy teachers said like pisiform, not pisiform, but I'm like, my mnemonic doesn't work if you don't know it. But again, pronunciation isn't part of this class. Maybe if you're going into clinic, you should correct your pronunciation, but for when you're starting out, just know that the triquetrum articulates with the pisiform. So again, my mnemonic is try quit before you piss me off. Okay. Or if you're not from the islands, well, how do you translate that? So in proper English would be, please stop because you're making me mad. Okay, right. So then trapezium and trapezoid. Again, anatomists, it's like, really, you couldn't come up with a more unique name. So my mnemonic for that, like, how do you know that the trapezium? Well, this is actually more lateral, right? So it's toward the side. This is on your thumb. So the trapezium articulates with the metacarpals of that eventually lead to your thumb. So my mnemonic is, go be smart, don't be dumb, your trapezium is on your thumb. So this is the way I remember that trapezium articulates with metacarpal number 1 that leads to your thumb. Trapezoid is just by process of elimination, the next one over. So it's not on your thumb, the trapezium is on your thumb. Okay. And then what we have here is a capitate. So capitate is like, I mean, that's what anatomists, they like to think, okay, it all looks different, but capitate, notice it's kind of like long and kind of tall, so think of it as like a tall captain of the carpal bones. And then you have the hamate, so it's kind of hard to see here, but there's a little hook here. So I like to think of it like when you see a ham hock, they have that little bone poking out. So I like to think of the hamate kind of shaped like a ham. It has that little bone poking out. The hamate has this little hook, so that's another way you can remember it. Alright, so what we have here are your carpal bones, and again, they all have different shapes, but it's kind of hard to tell them apart at first because they all look like short little pebbles or rocks. So this is my favorite mnemonic. There are many of them. Yeah, so long to pinky, here comes the thumb. Straight left to pinky, here comes the thumb. I love this one because it tells you the first letters of all of these, but it also has an order. So it goes like this. You start off proximal, and then go toward distal and boomerang. So you kind of start here with the scaphoid and then do a UE back to the thumb. But here's this when you're using mnemonics, this is the kind of the danger. You have to know which way you're oriented. Are you looking at the anterior? Are you looking at the posterior? Are you looking at the left hand, or are you looking at the right hand? So if you're using this mnemonic, you have to know which way where you're starting and where you're ending. Because if you start distal and end up going proximal, you're pretty much getting everything wrong. So this is where, like, but I like this mnemonic because it has directions, it has layers versus just being random all over the place. But again, when you're using these mnemonics, orient yourself, know where you are first, and then use the mnemonic. Okay, so we're done with the upper limb. So again, the pectoral shoulder girdle attaches your arms, your upper limbs. Now let's talk about the pelvic girdle. So the pelvic girdle is going to attach your lower limbs, your legs. Okay, so what we have here, so it's kind of like your pelvic girdle is like clamps that attach your lower limbs to your axial skeleton. So here's what the hip bone or the coxal bone. So it actually starts off as 3 bones that fuse together. So the 3 bones are the ilium, ischium, and the pubic bone. Now what we see here is we're looking at from the side. So if you had someone's bone and you're looking from the lateral view, you notice that it also has this socket called the acetabulum over here. Now if we're looking from the inside of the pelvic girdle, we would see that we have this iliac fossa. Again, it's a very smooth surface that attaches a lot of things and muscles to it. And the crest, all these crests, these spines, and you see that there's a lot of markings, but the ones I bolded are the ones I want you to concentrate on for this class over here. Okay, so let's flip it back, and now we're looking at the lateral side. So we're looking on the outside of the pelvic girdle. So we have these large bones right here, but you have this smooth surface called the acetabulum. And notice that it forms this little socket. And hey, remember how we have that glenoid fossa or glenoid cavity in the scapula? Well, the acetabulum kind of is kind of like the analog to that in the lower limb. Just like the humerus fits into the glenoid fossa, the femur, the head of the femur, fits into this acetabulum. And this, again, the coxal bone, the hip bone, has 3 main parts. So this is what's shown in this shading over here. So you have an ilium. This forms the largest part, and most superior part. Then you have the ischium toward the back. And where is your pubic area? That would be, again, in the genital and groin area toward the front, right? So your pubic bone is toward the pubic area. Now, what we have here is, again, remember, what do you call that big top of a wave when it goes over and crests at the very top? You call it the crest. And this is where we have the iliac crest. Now, what we see here is so the iliac crest forms that superior margin, so the top of that pelvic girdle. Now, you also have this auricular surface. So remember that your pectoral girdle has to attach to your axial skeleton somehow, right? And then you have your clavicles, and they attach to the sternum at that sternoclavicular joint. So this auricular surface is pretty special because it's where you actually attach your pelvic girdle to your axial skeleton. So auricle is actually, the root word for that means ear. So it kind of looks like a weird ear-shaped surface here. But you notice that it's actually, if you look at the zoom in close, you can see that it's kind of rough shaped. Well, the interesting thing is that it actually forms this joint with the sacrum. So this is the point of attachment of your appendicular skeleton at the lower limb. So we have the auricular surface of the pelvic girdle articulating with the sacrum over here. And why do you have all those little holes there? Well, you actually have a lot of fibers that it actually forms a fibrous joint that has all this collagen that kind of like helps to sew the two and glue the two together. So that's why it's kind of rough shaped when all that collagen is digested and you just have bone mineral left. So yep, that's the auricular surface. So the left and right hip bones articulate with the sacrum at this surface. And yeah, so what do we call those joints? And this is why joints, I wish nomenclature and naming things were as easy in the rest of the body as they are with joints, but you just call it the sacroiliac joints. So even though we had call it the coxal bone or hip bone, it's still important to know the original 3 bones that fuse to make a hip bone. And then what we have here, remember a tubercle is a small bump. So what we call the small bump down the anterior of the pubic bone, we call it the pubic tubercle. And over here is what we call the, so again, pubic area is toward the anterior. So we have this thing that kind of like joins the two pubic bones together at the anterior. So again, you have this is the posterior here, but toward the front, they come together to fuse or to form a solid structure or strong structure. So this is what you call the pubic symphysis. So you think of like when you see this root word sim, you think of it like it's like a symphony. A symphony plays together. So just like a symphony plays together, the pubic symphysis brings the two halves of the pelvic girdle in the front. So think of it, symphony plays together. The symphysis brings the anterior part of the hip bones together. Now what we have here is the gray or sciatic notch. And this is pretty important because again, remember when there's like a hole or recession or some sort of depression or some sort of like notch, it's making room for something. So it's actually making room for the biggest nerve and thickest nerve in the body called the sciatic nerve. So this is why you have a really big notch for that. And then over here we have yet another landmark. So this is called the ischial spine because it's kind of forming a ridge here. And it's toward the ischium. So again, the pubis is toward the front. The ischium is like inferior and toward the back and posterior of the pubic or of the hip bone. And so the interesting thing is that you're sitting on your pelvic girdle right now if you're sitting down. If you're standing up, then sit down and think, okay, which part of my body am I sitting on? So you're sitting on your buttocks, but if there's a certain part of your pelvic girdle that you're sitting on, and this would be what we call the ischial tuberosity. So when you're sitting upright and not in a weird position, like if you have your legs thrown up on the couch or if you're on your side, just if you're sitting straight up in the chair, your weight is balanced on your ischial tuberosity. So my mnemonic for that is that I think, okay, say you're skiing and then you're not a very good skier and you sit down. Which part are you going to sit down if you fall on your skis? You're skiing and you're sitting down on your ischial tuberosity. I know, that's the best I can do. I don't have anything better than that. So think of that. Sit down where you're skiing and you're skiing on your ischial tuberosity. Okay, and let's go to the obturator foramen. So again, foramen, if you look at the pelvic girdle from the front, it kind of looks like this, yeah? So this, where these little holes would be, this would be the obturator foramen. And hey, there's a nerve called the obturator nerve. Where do you think it runs through? Maybe it would run through this foramen that it shares the name with. So again, this is what it looks like from the front. So when you have all these holes, they allow passages for things. So this is why your bones aren't completely, they have all these indentations, they have these holes, they form passages, because you need blood to go to all the parts of your body. You also need nerves to carry signals to and from different parts of your bodies as well. And okay, so this one's a little tough. So the pelvis has a brim, and it also has these what we call the true pelvis and false pelvis. So the false pelvis is what we call this part right here. But the true pelvis is within this pelvic brim. So why does that matter? Well, and this pelvic inlet and outlet. Well, in the female body, what happens when a woman gives birth or through the vaginal route, and assume it's not cesarean, it has to actually pass through this true pelvis, through the pelvic inlet, and eventually out through the pelvic outlet. So this is why you kind of have like, if a woman has a narrow pelvis or the pelvic brim isn't wide enough, she might have to deliver via cesarean if the baby can't pass through. Like, remember, the baby does have some flexibility because the cranial bones haven't completely fused yet, but sometimes it is too small. Now, 6 differences between the skeletons. So if you're going to forensics or anthropology or archaeology, this is how they're able to say like, oh, this skeleton of this person who died years ago was a male or female of this age and whatnot. So there are general differences between male and female skulls, and not just skulls, but just also different parts of the skeleton. Now, I think it's kind of hard to tell it apart in these images, but I'm just going to go over, I just have a laundry list of things. So notice that things are kind of like, or actually, don't worry too much for this class, because again, these images, I don't think even OpenStax has like good images of this either. It's one of those things you kind of have to just see it it's easier if you see it in person. But what you see is like, okay, smoother general in the female, and the male is like, we have like heavier brow ridges, prominent parts of ridges everywhere, squarish, rounder. So what we see here in the female skull, smoother in general, less protrusions, smaller structures. But again, some people, if a woman has like a heavier brow, does that mean she's not a female? No, it doesn't mean that. It's just general differences in how they're able to kind of make a if archaeologists or forensic scientists are able to kind of like make a best educated guess as to the original sex of a skeleton. Now the pelvis is actually a little easier to tell, and you can even though, yeah, there's a sacrum, we have 2 hip bones, but the overall arrangement of the sacrum and hip bones and relative proportions are different. I'll focus on a few that are pretty easy to tell. So I think it's actually a lot easier to tell a male and female pelvis apart from each other. So what we notice is that between the iliac crest, you notice that the male pelvis, there's shorter distance, or it's narrower, whereas the iliac crest for the female pelvis is more flared out and wider. And that makes sense, because if a woman's pregnant, she needs more room in her pelvis, right? And then the thing is that also the sacrum as well. It's hard to see from this anterior view, but if you looked at it from the sagittal and in this view right here, so if the male pelvis would actually point more anteriorly over here, and it would also be a little more curved and hooked. So say it was somehow possible for a male to give birth, the baby would actually have less room to pass through as it goes from the pelvic inlet to the outlet. So for the female pelvis and sacrum, the sacrum is actually more oriented toward the posterior side to give more room, and has less of a hook and is generally flatter than the sacrum of a male pelvis. So again, it's flatter and more toward the posterior, because when you do that, you have more room over here. Now another thing is that the pubic angle. So this part between the pubic right here, so you have the pubic bones and the pubic symphysis forming the vertex. So notice that the 90 degrees. What's 90 degrees? Hey, all the way back to high school geometry, remember a rectangle or a square? All the degrees angles in the rectangle or square are 90 degrees. Another mnemonic you can use is like the male pelvis, like it's kind of like the between your index and your middle finger. So it's kind of the angle is kind of closer to this. Whereas the female pelvis, it kind of, the pelvic angle looks more like this, like between your thumb and your index finger. So male pelvis, the pubic angle more like this, the female pelvis more like this. But again, this is why, at least for me, it's way easier to tell the male and female pelvis apart than a male and female skull. But it's really cool because like there's actually another professor at the medical school, and he's not only 100% for identifying male versus female skulls. He can actually make good like guesses as to like what their genetic background or where their ancestry comes from based on structure. It's like there's general trends, but it's really hard to teach via 2D images. Anyway, going on to the next. So pelvic girdle attaches, just like the shoulder girdle attaches the upper limb, the pelvic girdle attaches the lower limb. And just like we have the humerus with our upper limb, we have the femur in our lower limb. So just like the humerus, you have a lot of things that are named similarly. So what we have are things like, instead of having tubercles, what we have are those trochanters, or if you like my mnemonic, the trochanter, right on top of that huge mountain. So this is why we have our trochanters. They're the largest, roughest type of projections among tubercles, tuberosities, and trochanters. So just like we have a greater and lesser tubercle in the humerus, we have a greater and lesser trochanter in the femur. And what we have here, we also have a head in the femur, and notice that it's very round and smooth, just like the head of a humerus. And this is what we call a ball and socket joint. We'll cover that very soon. But again, a ball and socket joint, the ball is going to be able to roll around. That's very important in terms of allowing these joints to be very movable and flexible within the socket. And the neck. So remember how that neck, like Big Ed, was like very fused in the humerus? Well, notice that the neck in the femur is more elongated and shorter. I'm not short, but narrow. So it's more like slender, and yeah, so compared to being totally fused with the rest of the proximal part of the bone, it's actually more prominent in the femur. So this is why the neck, there's no surgical neck, or the anatomical neck is the same as the surgical neck in the femur. Now what we have is a shaft, and this is also something that's harder to see in these images, but there's something called the linea aspera on the back of the femur. So this front part is pretty smooth, but this linea aspera, sometimes, depending on the person, sometimes it might be a little more prominent, but it's actually pretty like slight compared to like other obvious markings like the trochanters. But again, if something's raised or prominent, if it's a ridge or a bump, it attaches something, and this linea aspera actually attaches a lot of the tissues that are found in the thigh. And what we have here is the patella and popliteal, right? So popliteal. So the patellar surface is, again, the patella is the kneecap, and the popliteal is the back of your knee, right? So this is where if you got your landmarks down solid, it's going to pay off in spades for this unit right here. Now the patellar surface, this is why, notice that the patellar surface has this little facet right here. And why does it have this little like smooth surface? Well, the patella is going to, among other tissues, is going to glide across the surface. Now what we're looking at here is just like we have the condyles, well, the more specific names for them in the humerus were the capitulum and trochlea. We also have condyles, but they're just called condyles in the femur. So we have lateral and medial condyles, and we also have epicondyles as well. So again, this is yet another reason why you need to know lateral and medial. Now humerus versus femur. So again, if I show you a humerus, which is the humerus, which is the femur? Well, again, they are part of the upper, the humerus is part of the upper arm, the bone found in the upper arm. The femur is found in the upper thigh. And they have heads, they have shafts, they have necks. So how do you tell the two apart? Well, I look at the neck, especially this is one thing I can tell apart a femur from a humerus. Remember, the anatomical neck of the humerus is thick, it's there, but compared to this pretty shapely neck we see in the femur, and you can tell where the neck is clearly, the humerus has that thick neck. I also remember that the surgical neck. So the surgical neck is the same as the anatomical neck in the femur, but so the humerus has two necks. It has the anatomical neck here and the surgical neck. Surgical neck because if it breaks along this part, it's going to probably break on this part that's pretty thin between the very thick head and fused neck and the shaft over here. Whereas the femur, this is also a site of frequent breaks if you have a fracture. I also look at the tubercles and trochanters. So remember, the humerus has tubercles, and they are bumps, but compared to the trochanters in the femur, which are it almost looks like a horn for the greater trochanter. And notice that even the lesser trochanter pokes out way more than the lesser tubercle on the humerus. And then I also look at the condyles. So notice that in the femur, the lateral and medial medial condyles, they look pretty similar, but compared to the humerus, the condyles, the capitulum and trochlea, they don't look very similar. They're both smooth surfaces, but they don't look symmetrical or close to identical, whereas they look almost the same in the femur. So the femur's condyles look more similar to each other. Okay, so that's the way I tell the humerus apart from the femur. And the patella, so if I took a patella and showed you one side, how do you know which side is the anterior and which is the posterior? Remember how I said that there's some bones have some smooth surfaces and some have rough surfaces. Notice that in the anterior view of the patella, you notice that the anterior view is more rougher and the posterior view is smoother. And when you have a smooth surface, it's easier to glide on it, right? And where is the patella gliding on? It's gliding on all those bones and tendons and ligaments that are underneath it. So why is that anterior rough? Because you actually have tendons that attach to this part. So it makes sense that you have the part that's rough where you want something to grab onto it, and then front where it needs to attach all these tendons, ligaments, and other tissues. And the back where you want that smooth surface to glide to be smooth. Now, again, the patella needs to glide across the femur over here, so this is what we're seeing here. Now, going a little more, so what is at the distal part of the knee joint? So we have the femur forming that upper thigh, and now we're at the lower leg and calf. So what we have here are the tibia and fibula. So, I mean, common misconception I see, especially when we had the labs in person, is people would see fibia and tibula. No such thing. Sounds similar, but they're not. Yeah, there's no such thing. It's tibia and fibula, not tibula and fibia. But what we notice is that, okay, we also, just like we have with our ulna and radius, we have the interosseous membrane. So there are two bones in each leg, but we have a membrane that helps to hold it together. And what we have here is the tibia. Notice that it's pretty thick and it's the medial bone, whereas the fibula is lateral and towards the side. Now with the tibia and fibula, you also have something called the medial and lateral malleolus, or plural malleoli. But notice that the tibia forms this little structure over here, and the fibula forms this lateral structure here. So it's kind of like a little saddle, and what it sits upon is your ankle. So this is why you're able to move your ankle side to side, is that it helps to form some sort of stability on your ankle joint. So this is why you're able to kind of also rotate your ankle this way, but not only this front anterior like flex and extend your ankle, but also have some lateral movement as well. So the thing is that even though the fibula looks very thin compared to the tibia, if you break your fibula, that can also affect your stability in walking, because your fibula is very important for lateral support of your whole ankle joint. Now, if I show you the radius and ulna and tibia and fibula, how do you tell them apart? So these are the handy-dandy techniques I use when identifying a radius, ulna, tibia, or fibula. So what do you notice with the radius and ulna? Notice that compared to the tibia and fibula, the radius and ulna in their shafts have similar thickness, whereas the tibia is very thick, the fibula is thin. So another one mnemonic I like is saying like, the tibia is thick. So this thick is the thick one, and the fibula is thin. So you might think it's like thin like a fiddle, like, or if you play the violin, like the bow is very thin. Or you might, if you're trying to say fibula thin with a lisp, you might say, oh, the fibula is thin. So that's another way you can tell it. So there's a bigger difference in the thickness of the shaft of the tibia and fibula compared to the radius and ulna. And another dead giveaway that something's an ulna, that notch right there, right? So what we have here is that trochlear notch. So that ulna, if you see that scoop, that's a dead giveaway, that's an ulna. And then with the radius, if you look at the head of the radius, that round head, if I see a round circular head, I'm like, that's a radius right there. Oh, I like that one. If you told a little lie, you tell a little fib. So yeah, the fibula is thinner. And also the heads are oriented. So this is the head of the tibia. Here's the head of the, I'm not head of the tibia, head of the fibula. But the head of the radius is up and more proximal, whereas the head of the ulna is distal. And the head of the fibula is proximal. But there's no real tibial head. Yeah, so but I'll get more into that when we talk about the joints if we have time. Now, let's end on the foot. So just like we talked about the hand, so the great thing, if you know the bones of your hand, well, all you really have to worry about is the bones of the foot are the tarsal bones. So the great thing is that just like how you call your fingers phalanges in anatomical terms, your toes are also called, or what is it? Not just phalanges, but also digits. Remember, like you also call the toes phalanges and digits as well. So the great thing is that things like proximal, distal, and middle phalanges also apply to the toes. So what we have here with the bones of the foot, the phalanges of the foot, is that we have proximal, middle, and distal. And for the hallux, so again, our pollex is in our thumb, our hallux is in our foot. So our hallux is our big toe, and unless you're special and you have an extra bone in your big toe, you have two bones in your toe, right? So you have a proximal one and your distal one. If you somehow you have three, I guess you have a middle one, but if you have two like most people, proximal and distal. And then you have your tarsals. So instead of you having carpals, you have your tarsal bones in your foot. And just like how you have metacarpals in your hand, you have your metatarsals in your foot. So these are between the phalanges and your tarsals. And just like how you count from 1, 2, 3, 4, 5 in your hand, in the foot you start with the metatarsals and phalanges that lead to your big toe and go to your little toe. So you go from medial and count lateral. Now the tarsals, it's hard to see just from one image. You should look at your tarsals from multiple angles, and in the slides I have multiple angles of the tarsals as well. But what we have here, I love this mnemonic, so it kind of has traces of shape. So if you're looking at this is the right foot, and we're looking from the superior view on top of the right foot. So the calcaneus is what you would be your heel. And then you have your talus, which forms your ankle, and then we have your navicular. Then the medial cuneiform. Now, you have a medial, intermediate, sometimes it's called the middle cuneiform. You should know both intermediate and middle just in case. And then you have your lateral cuneiform. Common misconception, even though this is lateral compared to this medial one, some people think that the lateral one is this bone right here. So just know your three cuneiforms are together, and there's a medial, a lateral, and something in between. It's either in some books it's called medial cuneiform, but to avoid, or it's called the middle cuneiform, but to avoid confusion, I'm going to call it the intermediate cuneiform for this class. Then you have your cuboid. So this is why I love this one. It kind of goes in a C shape, so it tells you the first name of all of these bones, but it has an order to it. And yeah, cuneiform, I mean, it's like, if you know, like, was it, I think history class with the Sumerians, they say like, oh, the writing system was cuneiform. Like, who knows that these days? And it's like navicular. I mean, cuboidal, does that look like a cube to you? And navicular, I guess comes from the same root word as like navigate. They think, I mean, it does kind of have a boat shape, but I don't know. I think anatomists, when they were naming the bones, they have very wild imaginations. But I like this mnemonic because, again, it has some sort of order. It tells you the first letters, and I think the thing to watch out for is that the lateral cuneiform, do not confuse it with the cuboid over here. And this is another look at it. So again, the calcaneus and talus aren't on the same plane, so this is going to form that inferior, so it's going to form your heel. And here's your ankle over here, and then you have your navicular and medial cuneiform. So we're actually looking from the inside toward the outside. Okay, so yep, I know it was kind of a fast day today, but we had to it was one of those days where we kind of have to blow through the material to catch up. But again, if you didn't get it the first time, this is a skeleton, it's anatomy, and a part of it is just practicing. And I'm pretty sure somebody, like, this is classic, the skeleton doesn't really change. Maybe in 1,000 years it'll change, but I'm like, yeah, you probably can find a lot of resources for skeletal anatomy online, and focus on the landmarks and bone. I mean, okay, so we actually went through all the bones, and there are 206 bones, and I think it's definitely achievable for everybody to know all 206 bones. Sounds scary, but when you think about it, some of the bones are just numbered, like your cervical, thoracic, and lumbar vertebrae. You knock out a bunch of bones there, they're just serial numbers. And for the appendicular skeleton, even though it sounds scary that there's 206 bones, if you know the right half of a skeleton, you also know the left half of it. So you get 2 for 1 if you know all the bones of your appendicular. So I think the hardest ones to know are the ones especially the inner skull. They have those unique shapes. It's hard to visualize compared to the more superficial skull bones. Identifying the different types of vertebrae. Ribs, again, don't worry too much about determining what's rib 4 versus rib 5, but things with true ribs, false ribs, vertebrochondral ribs, floating ribs, those differences are pretty obvious. I think for your upper and lower limbs, the humerus, the radius and ulna, the femur, the tibia and fibula, they're pretty obvious. I think the hardest part with the appendicular are actually those carpal and the tarsal bones, because they're very small and their descriptions are approximations at best, but you also knock out a bunch of the bones by having the serial numbers for your metacarpals, and then the phalanges is numbered and it's based on either proximal, distal, or if they're in the middle. So yep. So now you should know all 206 bones, and I do expect you to know those little landmarks we're able to cover in class as well. All right, so enjoy your Friday, enjoy your weekend, and hopefully you all did well on your math test, those of you who are commenting on it in the chat. So thanks for hanging around. Thanks, moderators, for helping out today, and see you all on Monday.